Okay, hey everyone. My name is Rebekah. I'm a physical therapist. I'm here with virtual care today. That's care with a K. Virtual care presents clinician created and presented groups and individual wellness sessions. This virtual care is brought through my company IRG, and my clinic is in Tacoma. I'm the director here. I actually specialize in pelvic floor physical therapy. And the topic I want to talk about today is what exercises are important to avoid and important to do when considering the effects that they have on the pelvic floor and the pelvis. I'm going to stop right there for just a second, pull up my slideshow. There we go. Just cycle through the disclaimer, of course. And here's my topic. So as a pelvic floor physical therapist, I'm rehabilitating clients of both genders, and that is my market. And I really want to highlight that this isn't gender specific, information, that this is really pinpointed to humans of all ages. And we're talking about the pelvis, the structures within it, and the structures that make up the infrastructure of the pelvis. Many of the people that I rehabilitate are anywhere from painful conditions of the pelvic floor. There's urinary and bowel and sexual dysfunction. Those are sort of broad topics, but any client that I'm having, at some point, we're going to have to discuss exercises and strengthening of the core and the legs and the shoulder girdles as part of the whole package of the rehab with me. And as I have experienced over 11 years of doing this and looking closely at what things are safe and have the proper efficacy for this structure, it's come to my awareness that there are indeed exercises that are detrimental to the pelvis and everything inside of it. Whether it's items that can instigate herniations in the lower abdominal region, even up as high as the umbilical region, whether it's things that will progress prolapses of any sort for both genders, things that will not advance, but advance pelvic floor spasms is what I'm trying to say without saying it, but really challenge the integrity of the pelvic floor structures and wreak havoc in the Netherlands area. So what would be important to do right now, just outline a couple of highlights of what I want to work through to understand this. Most of my clients are also, trying to be proactive in their healthcare and their fitness by going into the market fitness world. And this is where we start to run into problems. I highly advocate yoga, Pilates, bar, and those avenues. I think they're really important to do. Unfortunately, it's in that market that you find exercises that are detrimental to the pelvis. And so there's not a lot of guidance out there. There's not a lot of pelvic floor physical therapists that do this, and to an advanced degree as well. And so with that, there's not going to be the instruction and the guidance in the market and the awareness of what is not good for this region. So this is to really give people of both genders some wherewithal, some guidance as to what to do, what to avoid. And with what to avoid, I want to provide what to do instead. So in order to understand why it's detrimental, we need to kind of look at the overall structure of the pelvic floor. So I'm going to move on to the next slide. And in this next slide here, we see both gendered pelvic floors. I can't really point with my cursor. Maybe I can. Hopefully you see my cursor on the left-hand side running along the gamut of what is the pelvic floor. It's going to be sort of like a hammock looking thing. Above that hammock, you see the viscera, you see the bowel, you see the uterus, you see the rectum, and over on the male side, I hope my cursor is showing you guys. From 0.6 to 0.8. 8 is the tailbone, and you kind of see this red line going between 0.6 and 0.8, and this is representing the male pelvic floor, and the viscera above. You have the prostate, the bowel, and the bladder above these structures. So the pelvic floor is a lining of muscles that cover the vacancy that is between the entire arena, the bottom portion, I would say, of the pelvis. And from this view, it looks like it's between the the pubic bone and the coccyx region or tailbone. So that's the pelvic floor on one end. And I like this other view here because it shows not necessarily gender specific, but it shows you another view to kind of understand the orientation and the complication of the pelvic floor. On the left-hand side, we're underneath the model. We're looking up at their pelvis. And on the right-hand side, we're looking down at the pelvis and viewing it from that angle. It's quite interesting. These muscles are quite ubiquitous. They cover a lot of territory. And you can kind of think of them as a hammock at the bottom of our pelvic bowl. The next slide is actually going to go way up the chain of command of our spine. We're going to look at the respiratory diaphragm. I hope that my cursor is showing and outlining on the right-hand side. You see this domed-like structure, brown sort of color, muscle, sort of brick color, of a dome that's kind of lining the bottom part of the rib cage. That's your respiratory diaphragm. Complete mirror image of your pelvic floor. Actually, they actually have a lot in common with each other that the scope of that does not quite allow enough time in what we're doing today, but it's something that's quite interesting. The respiratory diaphragm and the pelvic floor actually have a biomechanical relationship that I'm going to show on the next slide here. This is hopefully moving in your view. You should see the respiratory diaphragm at the top and the pelvic floor at the bottom. And they should, and hopefully your view is showing them kind of floating up and down. And this movement that you see up at the top at the diaphragm is respiration. So as we draw in a deep breath, what's pulling that breath in is the respiratory diaphragm muscle clenching downwards, and that sucks air into the lungs like a vacuum. As the diaphragm is descending down, there's gonna be a little bit of pressure that's gonna build up in the abdominal region. So you can feel that if you take a long, deep breath. You're gonna feel your rib cage move, you're gonna feel your belly expand out. This pressure is very, very important for so many organs of the body that we don't have time to go through and parse out what it does, but it's got a lot of implications for health of our organs. It's very important to have this motion going through the spine and abdominal region for a lot of reasons. But what I want to point out here, as it pertains to the pelvic floor, is that this pressure buildup is descending downwards, and it causes the pelvic floor to elongate like a rubber band. And as we exhale and the pressure in the abdomen is relieved, the pelvic floor floats back up to its resting position. A long story short, like a 2-hour-long story short, is that this helps in many ways to maintain normal tonality of the pelvic floor. It's a movement that it thrives on. It's a physiological entity that is very important to maintain the pelvic floor's tone, keeps it active, actually. So this intra-abdominal pressure, so inside the abdomen, is pretty much what we're looking at when we're talking about exercises for the core and some for the legs. This pressure system that you see right now, it has a particular threshold to it. With ventilation, that threshold it's not going to surpass, oops, I'm sorry, I'm going to go back one more slide. That pressure that builds up in the abdominal region is normal. If we surpass this pressure, we're now putting pressure on the abdominal wall, the pelvic floor, and all the organs that are suspended by ligaments. I'm sorry, I keep pressing the wrong button. And it will then challenge the integrity of those ligamentous stirrups that hold up our viscera or organs. It will challenge the integrity of the abdominal wall and the tonality of the pelvic floor. It can actually turn it off. It can make it rebound and spasm. And so this pressure that we're looking at here, this is what we're concerned about with the exercises. So while this is a normal threshold of pressure, I've got a couple of exercises to show you on the next slide that surpasses this physiological threshold. And there's too much pressure now, and it will challenge all of these items that I've mentioned. So let's look at that next. We kind of in fitness, I think in healthcare in general, it looks like we're really moving away from what the picture shows in the middle. The crunch style sit-ups are not as popular, and that's really exciting to see, because 10, 11 years ago when I started the specialty practice, it was like fighting uphill to convince women, and actually myself, that this was not the best thing for their pelvic floor. So we've come full circle, I think, and most people know to stay away from it. The problem is they don't know what then to go to. What do I go to now? So let's cycle through these. The most detrimental ones that I really tease out is, you see squatting. Double-legged squats are extraordinarily hard on the pelvis, because again, they push past a normal threshold of intra-abdominal pressure, the pressure inside your abdomen. Crunch style sit-ups, the same. And then jumping, you see a lot of jumping and box jumping and CrossFit and all that stuff. Such a hard pounding on the pelvis. So the next slide I would like to show you are their replacements. What I want to say about the replacements is that they are far more difficult. And it's interesting, when I did a lit review, to look at all sorts of different exercises we might do in physical therapy and we might do in fitness, the efficacy really jumped high. They were the highest ethical exercises to be done, the ones I'm going to show you next. The ones that we're looking at right now that they're most detrimental were the least efficacy. These get you the least outcome. And that's really good to know. So the thing that hurts you is a thing that's not going to get you that strong. There is a reason why you can do a million sit-ups, and I don't know about box jumping, maybe not, but squats, you got both legs working, it's kind of easy relative to the ones I'm going to show you. So that's the good news. So let's look at that next slide here. I want to start over on the left side of the screen and then work my way over to the right. So instead of double leg squats, what we can do instead is single leg squats, and the next one over to the right would be lunges. It's always good to have a spotter to make sure that your knee alignment is appropriate so you don't end up causing some patellar issues, of course. And then the next side over is planking. And this one was just so fun to look at a lit review, because this was so much return on your effort with this one, and really kicked butt in terms of how it compared to the crunch style sit-ups. And planking is difficult for most people, and there's a reason why. It's hard and you get a lot out of it. So there's that to replace the crunch style sit-ups. And then lastly, is lying on your stomach and lifting up to start regenerating the back muscles. I didn't want to look at these exercises, talk about core, without showing you the other side of your abdomen, which is your back muscles. Is so important to make sure that those are just as strong as your front. So that is my presentation today. So now you know what things to avoid, whether you're a guy, whether you're a girl, whether you're pregnant, whether you're not pregnant, wherever you're at in your lifespan, you know what to avoid in the fitness market and what to do instead as substitutions. Thanks so much.